Thank you very much, Mr. Speaker, honorable members. I rise this afternoon to support Budget 2022 under the theme, Steadfast Against All Challenges, Resolute in Building Our One Guyana. First of all, allow me to commend my colleague, Dr. Ashney Singh, and his team at the Ministry of Finance for putting together a fair, balanced, and transformative budget. This is going to lift us into the 21st century and beyond. Mr. Speaker, there is no doubt in my mind and in the minds of the Guyanese people that the APNU AFC's policies were reckless and it has wreaked havoc on our economy and has hurt thousands of people across this country. No one was spared of their callousness. They took away, as we recall, the Because We Care grant from the young, innocent school children. They took away the jobs from the sugar workers. And as if that was not enough, they took away the jobs from the CSOs. They took away the bonuses from the police, the army, the fire service, the prison service. All the annual bonuses disappeared under the APNU AFC. And of course, the pensioners were not spared because they also took away electricity and water benefits. Mr. Speaker, there's a big philosophical difference between the PPPC and the APNU AFC. We are here to serve the people of Guyana. While they were there, they served themselves and their cronies. This budget, Mr. Speaker, restores fairness by giving back expanded benefits to the young people, the old people, and the working people of our country. Mr. Speaker, this budget is also a balanced one. It provides the right policy mix, bringing relief to vulnerable people while incentivizing businesses to create jobs. It is not one or the other. It is doing both so that the whole country can benefit. But we have heard repeatedly here over the last several days that we should give away and give away this and give away that. But we didn't hear any thought from the opposition of how we are going to create jobs, how we are going to grow the economy so that we can make it sustainable. This, Mr. Speaker, is a recipe for disaster. Just recall the PNC's track record. Just recall the PNC's management every time they were in government. Their economic model left us drowning in poverty on the Burnham, on the Hoyt, and on the Granger. Mr. Speaker, this government, the PPPC government, does not apologize for working with businesses, be they big, medium, or small. Businesses are the engines of growth and the creators of job and prosperity in our country. And with the PPPC sound policy and prudence and stewardship, we have steered Guyana back to prosperity. Under the leadership of President Ali and this government and its budget, we are going to lead this the peoples of this country to collective prosperity. Not one set of people or that set of people, but all the people will be led to prosperity. This budget, it sets the foundation on which the future of Guyana will be built. It is not just the sheer size of the budget. It is about the content of the budget that is genuinely transformative. Mr. Speaker, when you go into the budget and you look at the contents, you would see the enormous investments that are being made in health, in education, in housing, and in social well-being of the people of this country. You would see the investments being made in the traditional sectors such as agriculture, construction of bridges, roads, hotels, and so many other things that our country needs. And it's not only that, Mr. Speaker. While we look at the traditional, we have also looked at the next generation of projects in the oil and gas sector, the gas to shore pipeline that is going to help us to get cheap energy in this country. Affordable energy, Mr. Speaker, is necessary if we are going to industrialize and move this country forward. Mr. Speaker, but here we are in these debates with the PNC and AFC, and I don't know if they still have the APNU. They have been here at their best, worst behavior, stirring all kinds of political mischief, with patent misrepresentations and failing on all counts on what it means to be honorable in this House. Mr. Speaker, we have heard from them fairy tales and fictional characters, and we heard about some Tamana and Sunita, fictional characters worthy of going for the Guyana Prize for Literature, which the Honorable Charles Ramsden has just resuscitated. But it's not only that, Mr. Speaker. All of a sudden, the members on that side of the House have suddenly found empathy. They are now lamenting. They are now lamenting all kinds of things, but their lamentations would fool no one. If anything, these absurd presentations that we have heard, the kinds of race baiting, and we just heard some of that from the Honorable Dr. Cummins, these kinds of juvenile tantrums that we have seen here would only serve to widen the credibility gap between themselves and the Guyanese people. Mr. Speaker, it is sad to see how much the palm tree has withered. But then again, why are we surprised? Agriculture was never their forte, so we shouldn't be surprised. Mr. Speaker, we just heard from the Honorable Dr. Cummins about things that we should be doing in the health sector. But under the APNU AFC and their stint from 2015 to 2020, the health sector was in the ICU. The whole health sector was in the ICU. It was a period distinguished by scandals in procurement. And we remember how there was a man in a basement in New York who was selling medicines to the APNU AFC government. We remember all the scandals of how they were going to procure drugs and medical supplies. And we recall that when we just got into government in 2020, that one of the things that we had to do was to throw away close to $10 billion Guyana of expired drugs. That is the track record. While there were shortages across this country and people could not access basic medicines. Not only that, Mr. Speaker, there were scandals in drug storage, and we recall the Sussex Street bond, how you had a bottom house, and in the bottom house, they were paying $14 million per month for bottom house storage. But not only that, some of you would recall the Auditor General report when they rented 7 rooms at Ocean View Hotel so that they can store drugs and medicine. And when they did the audit, what did they find? They find expired drugs, cockroaches, rats, and everything infesting the storage area. But that was not to be undone. They had another offsite somewhere in Water Street where they were storing lubricants. All of that is in the Auditor General's report. And they come here today to try to lecture us on how to run the health sector. Mr. Speaker, there were also scandals in the infrastructure projects that the APNU AFC did. Recall how much money they were spending on the head office at the Ministry of Health. Millions and millions of dollars was wasted, and we had to fire the contractor before we can get progress on that building. Recall what happened at Ocean View. They're proud to say that they built a hospital at Ocean View. But what was there? And I want to remind the people of this country what we took over. First of all, what we took over was a building that was not even ready to be a hospital. And guess what? It had no electricity, it had no water, it had no sewage, it had no oxygen, it had no equipment, it had no bed, and they called that a hospital. But that is not all. That is not all. What was even funny is that while the thing had nothing, 3 times they changed the name of the hospital. 3 times they changed the name. And then finally, they got Mr. Granger to go over there to open the hospital. And what they opened was a shell. Nothing was inside. But Mr. Speaker, we took that and we were able to turn it around, to buy the ICU equipment, the ventilators, bring them in so that we can get patients in that hospital. Mr. Speaker, I don't know what kind of barefacedness you would call this, when people can come here and try to lecture us about some of these things. Mr. Speaker, we had 3 ministers during the APNU period. You had Dr. George Norton, you had Dr. George Norton, you had Dr. Karen Cummins, and then you had Valda Lawrence. 3 ministers. And I'm surprised that when Dr. Cummins was a minister in the Ministry of Health, that she didn't know all these things that she was just talking about. I am surprised because none of it that she was pontificating about just now, that she was able to do while she was a minister in the Ministry of Health. But let's address some of the points that she raised. First of all, she spoke about the allocation to the sector. Well, I'm proud that this PPPC government has given $73.2 billion for health in this budget. This is the largest single allocation the largest single allocation of resources to the health sector. But guess what? The honorable member on the other side, Dr. Cummins, she came here and she opened her speech by saying that she is disappointed in the budget. But guess what? When she was the minister in the Ministry of Health, the Honorable Winston Jordan, then the finance minister, when he gave some paltry sums of money, the Honorable Karen Cummins was loud in praise for him. So she said, when they got 33.3 billion, she said, whoa, what a whopping amount that is going to the health sector. And this was in 2017. Then in 2018, when they got 35.9, well, when they got the allocation, again, she made some comments along the same vein. But here it is, the largest allocation to the health sector, and she is disappointed now. Mr. Speaker, this is the kind of behavior that we get from these honorable members. This is the kind of behavior when they come here and they try to tell us that this, what is in this budget, is not going to help people. The honorable member came here and she said to us that if we go into public-private partnerships, that we would not be able to manage them. Well, apparently when the honorable minister was there, she didn't realize that you had a public-private partnership with CHI, the Caribbean Heart Institute. And under this government, we have been able to increase surgeries, cardiac surgery, for the patients that need cardiac surgery. But not only that, we are also going to ensure that we broaden the scope and that we can get more partners so that we can perform more services for the people of this country. Mr. Speaker, you would have seen in the budget that one of the things that Dr. Ashley Singh spoke about was dialysis for patients. One of the things that we spoke about, and that was because when somebody was diagnosed with end-stage renal failure and they had to get dialysis, it was a one-off payment of $360,000. And after that, they had to find the resources to continue dialysis. Many of these patients, they could not afford it. And that was why we decided that we are going to ensure that we help these patients by providing them with $600,000 per annum. Not only that, the medicines that they would need to make sure that their blood levels are good, Epigen, Mr. Speaker, we are going to provide that from the Ministry of Health. And we are going to make sure that they can get that. And that's another 9,000 Guyana dollars. And sometimes every month they would need that sort of medicine. In addition to that, every 3 months they are required to do a set of laboratory tests, and we are also going to provide that at our hospitals. But guess what, Mr. Speaker? The honorable member talked about partnerships and us not being able to manage these partnerships. Most of the dialysis that is done today is done by NGOs and private sector partners. And we are going to partner with them to make sure that this service is delivered to every single dialysis patient. Mr. Speaker, we heard from the honorable member about chronic diseases, and in particular, she spoke about mental health. Well, one of the things that we saw happen during their stint in mental health was the creation of a mental health unit. And the mental health unit is supposed to help with suicide. You had about 21 persons who were employed in that unit, and they're supposed to be going out into the communities that are affected by suicide. But guess what? The places that got suicide is in Region 6, Region 2, parts of Region 5 and 4, and maybe some in Region 3. But the unit is centralized. And these persons were employed to help persons prevent suicide. They are not going out to the regions. And there was no hiring of anybody in those regions to help with the prevention of suicide. If we are going to really have an impact on suicide, we have to decentralize the response to make sure that we are closer to where the problem exists. And that is what we are going to do, not the centralized business that they had. Not only that, Mr. Speaker, very shortly we will be bringing to this House 2 pieces of legislation, one dealing with suicide prevention and the other one dealing with mental health services. And I hope that when it comes to this House, that the honorable member on that side would give us the support. But when we talk about mental health in this country, we have been partnering with Columbia University. And if the member does not know, just last year, right in this hall, we had an international psychiatry conference with some of the best minds in psychiatry coming to Guyana, talking to us, delivering papers, and they continue to work with us and will be working with us for the next 5 years in mental health and in psychiatry. That is what we have been doing, Mr. Speaker. If we look at the other chronic diseases, like diabetes, we have said, and we have set a policy, that we want to find all the persons who are affected by diabetes. We want to ensure that we are able to control their blood sugar. We want to ensure that we are able to control the high blood pressure. And if they are 40 years and over, we want to make sure that we can give them statins. As part of that program, Mr. Speaker, we have been collaborating with PAHO WHO, and we introduced a program last year called HEARTS. What that is going to do is to decrease the risk of getting these chronic non-communicable diseases. And also, we have changed many of the algorithms required to treat patients with these diseases. And we have bought medications that are going to be more effective in treating these patients. This year, Mr. Speaker, we are going to roll out that program to more than 80 health centers across this country. That is the shape of progress, honorable member. Mr. Speaker, it's not only in diabetes and hypertension. We have also been looking at how we can extend cancer care. And as you would know, Mr. Speaker, tomorrow we celebrate World Cancer Day. And one of the programs that we will be rolling out in a very comprehensive way is to make sure that we can reduce the incidence of cervical cancer in Guyana. We have to develop a program where we can do primary, secondary, and tertiary prevention. And for primary prevention of cervical cancer, which happens to be the second most prevalent cancer among women, the first being breast cancer. But if we focus on cervical cancer, it is a preventable disease. It is a disease that if young people get an injection, that it can be prevented. And there have been attempts. The first time we started that program, it was started under the Honorable Dr. Barry Ramsaran. But when it was started under Dr. Ramsaran, we did not get the support of the PNC at that time. They campaigned against it. And what happened? It resulted in a lot of young women not getting their vaccines. When they got into office, they tried to start the program, and it ended up not taking off. But I hope that this time around, because this year we are going to start a massive program to give HPV vaccination to girls between 9 and 14 years of age, and I hope we can enlist their support. Mr. Speaker, for secondary prevention of cervical cancer, one of the things that we want to do is to extend screening to make sure that women 30 years and older can access screening, and therefore we'll be having more VIA clinics, more pap smear, and we will be introducing HPV tests so that we can screen for cervical cancer. And at the tertiary stage, we are going to create more access to ensure that people who need surgery can get surgery. Those who need chemotherapy can get that, and those who need radiation therapy will be able to access that as well. That is how we are looking at this thing in a holistic way. Not a little piece there and a little piece there, and then they don't fit together. And this is what we'll be doing for cervical cancer. In addition to that, Mr. Speaker, the most prevalent cancer among men is prostate cancer. And one of the things that we'll be introducing with the resources that has been allocated in this year's budget is PSAs. Because for the first time we now have the money to be able to buy that machine, and we'll be doing PSAs in the public sector. Hopefully, we'll get the men to come out so that we can screen them and we can make sure that we can prevent prostate cancer. Mr. Speaker, you know, one of the things, Mr. Speaker, in this budget, one of the main things in this budget that is going to transform the health sector is the hospitals that we will be building. There are 6 new hospitals. 6 new hospitals. The first one, let's start from region number 2. It would be in Anna Regina. It is the most populated area in region 2. Why should they not have a hospital there? And that is what we are addressing. So we will be putting that hospital in Anna Regina. Mr. Speaker, in region 3, where is the growth pole in region 3? You have Tushin, you have Parika, you have all those communities around there, where there are lots of people who are living around there because of the housing development. And we need to make sure that they have access to health care. And that is why we are going to put a hospital at Dikendron. We look hard to find land, and that's where government land is located, so we are going to put the hospital there. And we make no apologies for that. And then when we come in Region 4, the Georgetown Public Hospital has always been seen as the national referral hospital, but also the regional hospital for Region 4. We want to change that. We want to ensure that Georgetown Hospital can remain a national referral hospital and do the complicated cases. And that is why in Region 4 and the two corridors, we will be making two new regional hospitals. One on the East Bank at Diamond, and the other one would be on the East Coast at Enmore.
Honorable Minister, we're going to have to give you an extension to tell us where you're going to place the others.
Thank you, Mr. Speaker. I'd like to ask that the honourable member be given 5 more minutes to conclude his presentation.
Thank you, Minister. Honorable Minister of Health, you may continue.
Thank you very much, Mr. Speaker. In addition to the two in Region 4, Mr. Speaker, we are going to build a new hospital in Region 5 at Bath Settlement. Again, that's where the population is located. That's where the population is located, while at the same time, honorable member, we are doing a lot of renovation works right now in Maikoni. Maikoni over the last year got a new accident and emergency, new theaters, and they're all functional with recovery areas. You should go out some more, honorable member. You would see the development that is happening in the health sector. And then we go to Region 6. And in Region 6, we are going to replace the Skeldon Hospital with a brand new hospital at number 75. What would these hospitals look like, Mr. Speaker? Mr. Speaker, we recognize that many of the outpatients, they're not comfortable for patients. Many of the accident and emergency, some of them do not have the necessary equipment so that when people come there, they can be attended to. We don't have modern equipment and infrastructure. In this country, in the public sector, we have about 3 CT scans. Each one of these regional hospitals would have their own CT scans. Each one of them would be equipped with digital x-rays. Each one of them would have ultrasound so that people do not have to travel from all parts of the country to come to Georgetown to get access to these things. But it's not only that, Mr. Speaker. All these devices are going to be internet enabled. What that means is that when you do a CT scan in Skeldon or in Anna Regina, it goes up in the cloud, it will be pulled down at Georgetown Hospital, read by the experts at the hospital, and you can have a very professional interpretation of those results. Laboratories, modern laboratories would be at this hospital, or these hospitals. But it's not only that, Mr. Speaker. This country right now, our hospital, regional hospital stock is about 9 hospitals. Already we fix up Latem. We have just completed Mabarua. We are also finishing off the district hospital at Lenora. We just finished the Diamond Diagnostic Center, and all of these are now operational. But in addition to all of that, one of the things that we'll be doing, Mr. Speaker, is to ensure that West Demerara Hospital is also fully rehabilitated. Mr. Speaker, I want to move on to another flagship program that we have in the sector, and that is the Maternal and Child Hospital that we will be building. This hospital, Mr. Speaker, would ensure that we take healthcare to the next level. All the high-risk mothers would have access to service at this particular hospital. And every subspecialty in pediatrics would be offered at this hospital. So if you have children with cancer or with any other illness, they'll be able to come there and get specialty service. So this is what we are doing. When we talk about transformation, we're not just talking, we are ensuring that we can deliver on this transformation that we spoke about. And I heard the honorable member talking about human resources, and I just want to say very quickly that we have partnerships with Harvard, we have partnerships with Johns Hopkins University, we have partnerships with York University, McMaster's, we have with Northwell, the hospital chain, we have with Mayo Clinic, we have with Mount Sinai. All of these are world-class partners that are going to help us to develop this sector. Mr. Speaker, this is what Budget 2022 brings to the people of this country. Thank you very much.
Thank you, honorable member.